Morning, everybody. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. I'm going to take a moment to click buttons to make sure that all of the media who have joined us have permission to record. As usual, you will have permission to record this briefing, and we are also recording, and we'll make that link available on the Health District's website and our YouTube page later today. So give me just a moment. Okay, I think I've given everybody permission to record, but if you run into any issues, please send a chat to the Joint Information Center in the chat box and I will get that fixed. County Executive Dave Summers had an internet connection issue and is unable to connect today, so he's not able to join us. So we do have Snohomish Health District Health Officer, Dr. Chris Spitters. He'll share a few remarks and then we will take questions using the chat feature. Please make sure you have your questions sent to everyone so that everybody can see those questions. With that, I will turn it over to Dr. Spitters.
All right. Well, thank you, Heather. Good morning, everyone. Let's start out with our usual COVID case counts during the last week up through last Saturday were 2,062, bringing the 14-day case rate through Saturday, September 11 to 469 cases per 100,000 residents. So the good news is that the rapid increase in cases that has brought us to this difficult point seems to have leveled off over the last couple of weeks. The bad news is that we've leveled off at an extremely high transmission level, as high as we've ever seen during the pandemic. Currently, in a crowd of 100 people in Snohomish County, there is a 75% chance that at least one contagious COVID case is present. For a group of 50, that risk is 50%, and even for a group of 10, that risk is 12%. Meanwhile, 106 Snohomish County hospital beds this morning are filled with COVID patients, 19 of whom are on ventilators. On the vaccination front, we continue to make only incremental small progress. 57% of the county's residents are fully vaccinated, but over the past month, only 5,000 to 6,000 people per week have initiated vaccination weekly. And if you do the math on that, it would take us almost a year to get all 200,000 folks done. So we're hoping for that to pick up speed. And remembering that we still have about 125,000 children under the age of 12 who are not yet eligible for vaccination. Testing volumes continue to remain high. Last week, Health District testing sites alone conducted nearly 2,700 tests, and approximately 20,000 tests were done countywide, including 600 tests alone on Saturday and Sunday at the Ashway Park and Ride testing station operated by the Health District. I want to give another reminder that we've closed the Linwood Food Bank testing site. We've had some people register for a test spot at the Ashway Park and Ride and then show up at the old site only to be disappointed and realize they went to the wrong place. So just remember that when you sign up for Ashway, go to Ashway. That's located just west of Interstate 5 off of 164th Street Southwest in South Everett. The Central Everett testing location is at 3715 Oaks Avenue. It's open 9 a.m. to 4 p.m. Monday to Friday, and access is off of the 37th Avenue street coming off of Broadway just as you come off Interstate 5 from the south. The last update for today is around masks and gatherings. In addition to masks being required in most indoor settings, Governor Inslee announced last week that masks will also be required for large outdoor gatherings effective yesterday. This expanded the mask order to take effect statewide and applies to all outdoor venues with 500 or more attendees. This includes festivals, fairs, concerts, and sporting events. I also join local and state health officials in strongly encouraging people to wear masks outdoors in crowds of any size, whether it's an organized gathering or not, when social distancing could not be maintained and you're around people that you don't live with. Furthermore, I also recommend that everyone consider delaying or moving non-essential events and meetings to a future date, or move them online to a virtual format. If it does not need to happen in person right now, I think it's in everyone's best interest to reschedule or hold things online, remembering that we're at the highest transmission rate we've ever seen with this pandemic. And that previously we would, we have the benefit of remaining open, but let's use that freedom wisely and judiciously for conducting our essential activities, education, employment, grocery shopping, going to get health care, things like that, and try to take it easy on some of the non-essential aspects of life that we all want to return to enjoying, but now is not the time. We need to decrease transmission as quickly as possible, or begin to face even more serious problems in accessing healthcare. So now's the time to get vaccinated. Keep a low profile as much as possible, and if you do go out, please mask up. And with that, I will turn it back to Heather.
Thank you, Dr. Spitters. We do have a couple questions coming in. As a reminder, please put those in the chat box. First one, what are we seeing on COVID cases in the schools?
Right. Well, schools have been in for, some schools have only been in for essentially a week. Others have been in for 2 or 3 weeks. As of yesterday, we had 74 school facilities in the county reporting 1 or more cases. There are 5 sites with 2 or more cases, and no sites at this time with more than 5 cases. And the split on staff to students is roughly 2 student cases per 1 staff case. 12 of those COVID events, if you'd call them, 1 or more cases, are associated with athletics.
One of the more common reasons folks are giving for not getting vaccinated is that they've already had COVID. What would you say to an unvaccinated person who has had COVID?
Get vaccinated. I think that the immunity from disease, from what we call naturally acquired immunity from getting the infection itself, is certainly protective, but the duration and the breadth of that protection remains to be determined. And folks who spend all their days looking at this and looking at efficacy of the vaccines, immunogenicity, duration of immunity, all, it's a clear recommendation from the Centers for Disease Control and Prevention to get vaccinated, whether you've had COVID or not.
Following Bob's question, at what point would you recommend a return to remote learning? What transmission rate would demand that?
Yeah. Well, I think that I think the broader question is what parameters and contingency plans are out there for addressing transmission in schools that would merit what would cross the threshold of trying to either close down a classroom or close down a school, or move kids, move students off site for a while. And the current state and state health department and OSPI guidance does not have that. And so I know efforts are afoot to try to define those things, but for the time being, we'll have to use our experience based on the past and, look for signals of a problem where we would need to close a school or a classroom to interrupt transmission when usual mitigation efforts are not working. So I realize that's a very qualitative answer, and your prompt was more like, what are the quantitative criteria? but we really don't have those right now. I think the key thing though is, one, as an underlying principle, my sense is that our elected leaders and society highly value education for kids. And while we want them to be safe and the staff to be safe, and we don't want unmitigated transmission and the consequences of that, both in terms of health and, quarantines where you've got lots of people, out of school because they were exposed, we still highly prioritize education, K to 12 education, and we really kind of think of it as should be the last to be pulled out of action and the first to be put back in. And so, again, we'll be looking for signals that the mitigation measures are not effective in a particular classroom or school, that sort of thing. I doubt that never say never, but even at this high level of transmission, I don't think that, there's a reason to, have a system-wide, backing away from in-person learning. I think that we're kind of past that at this point, but nevertheless, situations can and probably will arise where we may need to temporarily close a classroom, a group of classrooms, even a school, and have kids work remotely on an interim basis while we interrupt transmission in the school. Further details on that approach are pending, and in the meantime, we'll take it on a scenario by scenario basis.
Where does the county stand on hospital capacity?
Well, it's very similar to last week. Things really haven't changed in Snohomish County, in the Puget Sound region, and throughout Washington State, and frankly, throughout the country. Now, and I encourage all of you to, if you haven't had a chance to read Dr. Cook and Mr. Reddick's letter, I think it's a opinion op-ed piece that was in the Everett Herald over the last couple of days. I think the link might be there. Kent just posted it, and I think that gives a great qualitative sense of what's going on in the hospitals right now, particularly a close-up view of the hospital that provides the majority of inpatient care and the vast majority of COVID care in the county. And things are grim, and they haven't really changed since we last spoke. The number of people in the ICU might be down by a handful, but basically we've plateaued at a very high level. The healthcare system is under great strain, particularly with respect to staffing, that is finding enough people to staff the beds that might be available, as well as the 18-month ordeal that healthcare providers, particularly those on the front lines of acute care, have been going through. So status is the same as it's been over the last week or two, and hospitals have kind of maximized their efforts to operate on a contingency basis and to avoid having to impose, triaging access to care, crisis standards of care. And our hope, obviously, is that we can evade that with this wave, but we need everybody's help to get vaccinated, turn down the activity, mask up in public, and try to spare acute care capacity for all 800,000 of us, and give those healthcare workers a break. Those folks have been on, at the edge of a spear for 18 months now.
Do we have any updates on number of cases connected to the county fair, or is it still too early to tell?
I don't have anything on that, and it could be tough, because we'll let you know if we end up discovering a cluster or an outbreak connected to the fair. But like many large venue activities, if I attend there, but I also was on a plane flight, and I also sat in an emergency room, waiting room with my family member for an hour, it gets a little hard to sort out where that infection came from, especially when disease is so widely prevalent in the community at this time. So that's my tempering your expectations for us to have found something, is it's a little hard to peel that apart. It's easier to find it in staff members of the of the place because we know where they worked, but it's a little bit harder to tease apart the patrons, the people who attended, and if they got COVID 5 days later, is that where they got it or somewhere else? But certainly if we get a signal, we'll share that information. Absolutely.
What will happen if vaccinations stall and this is where we remain? What will life look like if people just say COVID is going to be part of life?
Well, there's a lot of truth to that statement, that COVID is currently a huge part of our life. And, many people wiser than me who are watching this think that we really need to anticipate that this, even if COVID kind of transforms over the coming months and years into a seasonal respiratory illness like influenza and other coronaviruses that are more mild, it's not going to be mild like those. It would be more serious like it is now, hopefully just fewer people getting it. And so given that we're not, I don't think I'm too far out on a limb to say eliminating COVID, an unmitigated victory against COVID in the near future is not on our menu. And so we're all going to have to live with it. And that's going to mitigate its effects and try to keep society going and have some new sense of normalcy. Vaccination has to be a key ingredient with that. So actually accommodating COVID is really going to require vaccination, or whether it's this winter or next winter or the one after, if we have dual winter respiratory waves of medical surge. Every year already, influenza puts the hospitals on the brink before COVID. So now we'll have two of those. So again, I think it's really going to be about all of us, including businesses, schools, employers, and the healthcare system. We need to keep in mind that this is probably not going to go away permanently at any point in the near future. And that all those measures we're taking, that both the non-vaccination preventive measures and vaccination, are really the only way we're going to be able to navigate through this successfully without having such disturbance to society, the economy, education, and recreation and family time and leisure.
Do you think the president's vaccine mandate will help the county's vaccine numbers?
I certainly hope so. We'll have to see. I hope so.
What are the vaccination rates amongst those employed by the Snohomish County Health Department?
I don't have that information, and I'd have to. I'm not sure if it's something we can share or not, because it's kind of the personal health information of the staff. I know it's very high, and I know it's not 100%. But all of our anybody that works for us that falls under any of the existing requirements, for healthcare workers and that sort of thing, are all covered. And I guess since we've got more than 100 people, we fall under the president's directive, and so we'll have to manage that going forward. So we've got great coverage, but I know it's not 100%.
What are your thoughts on establishing vaccination passports and limiting activities to fully vaccinated people?
Yeah. Well, I think this speaks to the broader issue of, when we've got someone taking or not taking an action that make consequences for the commons, for all of us, then generally you do try to make policy directed at that action. So in this case, if you heard Dr. Cook speak last week, or you read the editorial that they submitted, 71 out of 72, I think it was, intensive care unit admissions to Providence's ICU last month were in unvaccinated individuals. So there's an example of a lot of eligible people either not making a choice to get vaccinated or choosing to not get vaccinated, and then it having not only dire personal consequences for them, but branching impacts for society. And I'm not a policymaker. I'm a technocrat, that's here to implement policy and law. And but speaking to that, that I see as the broad policy question for our elected leaders and policymakers. Vaccination passports are not without their shortcomings. When you think about sort of the microeconomic impacts on, it's not as big a deal for large employers that, for large venues, that can have enough staff and capacity to implement this. For smaller businesses, they may not have the staffing or sort of the infrastructure to implement that, and that could push many smaller businesses who are already on the brink over the edge, or at least be a challenge for them. And to the extent that smaller businesses that would be affected by this are more likely to be owned by folks at the lower end of the income spectrum, as well as racial and ethnic minorities, that carries equity concerns on a variety of scales. And then it is taking a government interest and pushing it on a vendor or an enterprise to implement something that a third party, is whom we're trying to affect. And so that's got some challenges. And, we don't have any evidence base that this, if the policy goal is to raise vaccination rates, we've actually got, I believe, no evidence out there that this raises vaccination rates. Now, it might have a short-term beneficial effect if it were to, kind of keep people who are unvaccinated or infectious out of gatherings, venues like this. That might reduce transmission. But, interestingly, moving away from, epidemiology and public health analysis, I looked at an economic analysis over the weekend that looked at this very question of vaccination passports, and from their modeling view, that they really don't come up with a scenario where it raises vaccination rates. It may yield benefits in terms of reducing transmission by keeping unvaccinated people out of those venues, but the long-term sustainable impact that's desired of raising vaccination rates is, I think, uncertain at best. And so I think at this time, we don't have any imminent plans to go down that road, but, we'll keep an open mind, see what the experience of others is, and see how some of these other interventions that are largely, sort of maybe carrying the load between, big employers starting to do this, and then sort of culture leading enterprises like all the professional sports teams are moving in that direction for their spectators. So we might just see a natural flow in this direction that would help us move in that direction.
Some people are not getting vaccinated because they say they're otherwise young and healthy, not smoking, not overweight. But healthy means different things to different people, and there are many more risk factors. What do you say to those people?
Get vaccinated. I apologize for the curtness, but not for the message. I would submit that we have a social contract to try to help all one another out, even when that intervention doesn't, when the future benefits of getting vaccinated are much less for a 25-year-old healthy adult than they are for a 65-year-old healthy adult. But we are a society and we need everyone's help. That's why we require all kids in schools to have measles, mumps, and rubella vaccination. even though there's no measles, mumps, or rubella circulating in the community, to maintain sufficient immunity to protect society. That getting that shot is as much about protecting others as about protecting oneself. And, you know, I'm not here to moralize or give a lecture, but there's certainly a precedent for that in our society, not only in healthcare, but beyond that. So I don't buy that it's that's sufficient reason to not get vaccinated when you look at what's going on in society, in our hospitals, kids trying to get educated, parents trying to get to work. I think the only rational response is for folks to get vaccinated.
We've got 2 more questions and then we'll wrap up. It's not an easy answer, but how do you get people to understand the severity of the current COVID situation to curb transmission?
Yeah, it really, you know, and I'm concerned. In fact, our healthcare, my healthcare colleagues have sometimes wondered, you know, they sense that, you know, hey, in my personal life, I don't think people are getting the message about how bad it is in the hospitals. And I don't know how to better communicate it. You know, we give the numbers, maybe that's not it. Again, I encourage all of you, both, you know, anyone that hasn't, and all the listeners and readers out there beyond, to take a look at Dr. Cook and Mr. Reddick's editorial and what's going on. And again, it's not just the patients that are suffering, that are in the hospital, but there's people who, you know, have a lung nodule and are waiting to get their cancer diagnosis, and either, you know, then get on the road for treatment or be relieved that it's not cancer and something else. All kinds of stuff like that is being delayed. These aren't like, you know, super elective procedures there. I consider them pseudo elective procedures. Lots of stuff being deferred. The healthcare system, the people that are taking care of us are tired and worn out and still coming to work every day and getting the job done. But they've been in that war for 18 months and people are leaving the field. And so, you know, the pool of people that are available to take care of me and you and the rest of us a year, 2, 5 years down the line is being diminished by this, because we're burning people out. And so again, as a society, we got to think about the impacts that we're having. Not only, you know, not all these other things we've been talking about, but our healthcare workforce is a major asset of the common good, and it's eroding as a result of this. And so, you know, there's no thank you sign that can do as much as, you know, getting vaccinated and taking the measures to reduce your risk of catching it and spreading it to someone else, whether you or somebody else ends up in the hospital. And young people do end up in the hospital. It's just not as often. You know, so even the healthiest young adult might end up in the hospital. It's not a guarantee, but really we got to preserve our healthcare system and its staffing for the long run, because if they leave, a lot of them aren't coming back.
Last question, any updates on timeline for kids to get vaccines?
Well, yeah, I wish it was yesterday, you know, with school starting and all that, but we're just not there yet. I'm not seeing a lot of information about that, so I can only relay to you what I've heard before, which is, you know, every once in a while it comes up in, you know, meetings of CDC's advisory committee on immunization practices. There might be a brief update that they're expecting, you know, the phase 3 trials and, you know, an application for an emergency use authorization sometime around the turn of the year. And I wish I could be more specific, but I can't because I don't know.
Great. Thank you, Dr. Spitters, and thanks for everybody joining us today. We're going to go ahead and wrap up with those questions. Make sure you stay tuned for future media availabilities, and this recording will be posted later today. Thanks and have a great day.